How can we design policies that promote better health to everyone? During the COVID-19 pandemic, policymakers created dozens of policies a day. They imposed lockdowns, closed schools, and advised us to work from home. These policies helped stop the spread of the coronavirus, but also caused harmful effects. To help people cope with these unintended effects, local policymakers introduced mitigation policies. Still, some people were affected more than others. To learn how to anticipate these negative effects, we studied how similar policies in other situations created inequalities in health. We are researchers from the Department of Public Health in Rotterdam. We identified 199 policies and searched the literature for their effects on health by looking at differences by characteristics like education, sex, occupation, and socioeconomic status. Here are some of our results. We found that the stress of working from home can increase the risk of cardiovascular disease. Surprisingly, this risk is higher for women than for men. Loneliness and social isolation due to the lockdown can increase the risk of cardiovascular disease and depression. These risks are higher in women, people with a low-quality social network, and people with a low socioeconomic status. How can we avoid these differences in the future? Whether it's a policy on employment or housing or any other domain, we always need to consider the effects on people's health. More importantly, we need to make sure that some groups are not harmed more than others. If we do this, we can design policies that reduce health inequalities. Want to know more? Find our full report and infographic at savior.nl.